Hi, our signature assignment is gestational diabetes. To introduce our case study, Emily is 29 years old and 24 weeks along in her pregnancy. She presents to the clinic for a prenatal visit following a glucose screening test that showed elevated blood glucose levels. She has just been informed of her diagnosis with gestational diabetes. Her vital signs are stable and pre-pregnancy weight was around 150 pounds. Today she weighs 165 and is 5'3" inches. She reports no significant medical history prior to her pregnancy.
Come in.
Hi, my name's Victoria. I'm going to be your nurse today. What brings you in?
I have gestational diabetes. I've just been told that.
Oh, okay. How does that make you feel? How are you feeling?
Sad. I'm scared. I don't have anyone in my family that ever had this, and I don't really know what it is.
Okay. Well, gestational diabetes is common. That being said, we have many ways that we can treat it. Okay, first things first, let's make sure that we focus in on your diet. What's the last thing you ate?
I actually have it with me.
Okay, let's take a look.
So I love this. It's really good. Have you tried it?
Is that a Hershey's candy bar?
It is. It's a good bar.
I do like a good chocolate candy. Okay, and then what else? What's next? Is this an energy drink?
It is.
Okay. Let's check in with Dr. Venema and let's see what she says about this. I know that chocolate is not the best when you're trying to control your gestational diabetes. And then energy drinks I don't believe is good in general to consume while being pregnant. We'll go ahead and check in with Dr. Venema and see what she says, okay?
Can I have it back though?
Yeah.
Okay.
Okay, so let's talk about your diet now. What do you normally eat?
I eat a lot of rice and tortillas.
Okay.
I also work at McDonald's, so
Okay.
I love their fries.
Okay.
And I eat a lot of it throughout the day.
I can totally agree with you. I love McDonald's fries also, but in moderation, right? So we want to make sure that we're eating more lean protein.
I eat chicken from there.
Okay. Is it fried?
Yeah.
Okay. So we want to make sure that we eat lean, healthier chicken.
I won't eat it anymore.
Okay. Yes, that's fine as long as you know now, right? And how about vegetables? Do you incorporate those in your meals?
Not much.
Not much. Okay. What kind of vegetables do you eat?
I eat cauliflower, roasted cauliflower. I don't fry it.
Okay.
And sometimes cabbage.
All right. So I can refer you to a dietitian and she can let you know on what meals are good and then what meals are not as beneficial to you, and what meals can be more harmful to you with gestational diabetes, okay? So we want to make sure that we do eat under 60 carbs a meal, breakfast, lunch, and dinner. And do you think you're able to do that?
Yeah, for my baby.
Okay, yes. And then we also want to make sure that we monitor your blood sugar levels. Do you know how to check your blood sugar?
Yeah, just prick your finger.
Yeah. Do you know when to check?
No.
So I'm glad that you know how to check your glucose levels, but do you know what levels they need to stay under?
No.
Okay, so you typically need to take it prior in the morning, right? Prior to eating anything or drinking anything. And that level is your fasted level, and that level needs to be under 95.
Okay.
And then as far as after your meals, you're going to do it 1 hour after, and it needs to be under 140. Okay, does that make sense?
Yes.
Okay, great. So make sure that you're keeping those logs. Any other questions that you have?
I do. So what if I don't follow the plan, and what if my gestational diabetes just gets worse?
That's a great question. I love that you're concerned about that. But so far, it sounds like you're able to help yourself and manage those things. Also, I'm going to refer you to that dietitian. You're going to talk to Dr. Venema, and then she'll give you more information. But some complications can include macrosomia, which is an enlarged baby, shoulder dislocation of your baby.
That sounds scary.
During labor, yeah, and even C-section, which I know is not part of your care plan, right?
That sounds very scary.
Yes, but it sounds like we're able to control it. We caught it really on. You're only 24 weeks pregnant. You'll keep coming in for your regular checkups. Dr. Benema will keep checking in on you. I'm so sorry you're scared, but I know that I just told you worst case scenario. Since you sound like you're able to control your gestational diabetes, there shouldn't be any further scary scenarios in your future, right? I'm so sorry that you're going through this, and
Okay.
if you have any further questions or concerns, please feel free to call us, and we'll be happy to connect with you with someone else, okay?
Okay.
All right.
I think I'm okay now.
Okay.
I feel better.
Okay, good. All right, take care.
You too. Come in.
Hello, Emily. I'm Dr. Benema. How are you doing?
I'm feeling better than before, but a little scared.
A little scared about the gestational diabetes.
Yeah.
Okay, that's completely normal. Do you know anything about the labor and delivery process with gestational diabetes?
Not much, no.
Okay, so during labor and delivery, we're going to regulate your blood sugar levels,
Okay.
and if they're well controlled, everything will proceed. And however, if the baby does end up being large, we could potentially have to do a C-section, but we should be able to determine that by ultrasound a little sooner.
Okay. Am I going to need insulin during labor?
So if your blood sugar levels rise, we may need to give you some insulin to stabilize them, but we're going to be monitoring you and the baby the whole time to make sure you guys are okay.
Okay, that's reassuring. What about my gestational diabetes after delivery?
Okay, yeah, so gestational diabetes typically resolves after birth, but we do recommend you have a follow-up appointment 6 to 12 weeks after to check your glucose levels and just make sure that you don't have type 2 diabetes, because that is a risk after birth. So I'll go ahead and schedule that appointment for you 6 weeks out after delivery, and we can check those levels for you.
Okay, so that means I can't eat my candy and energy drinks, or can I still?
Yeah, so after birth, you're definitely going to want to keep maintaining a healthy lifestyle, and I would recommend working out about 30 minutes a day, even if that includes going on walks, bringing your baby in the stroller. That can help out a lot. You want to keep that balanced eating, keep it below 60 grams of carbs per meal. We just really want to keep those glucose levels under control so that you don't develop type 2 diabetes.
Am I still supposed to monitor my glucose levels, or I don't have to after birth?
Yes, you should still be monitoring them every day, once in the morning fasted, and then an hour after every meal.
Okay.
And then once we test for that, when you come in 6 to 12 weeks after delivery, then that will tell us if you have type 2 diabetes or not. And if you don't have it, then you'll be good. You don't need to do glucose checks anymore.
Okay, that's a good plan.
Yeah, so just make sure you're keeping that healthy lifestyle, healthy diet, and